Hello friends, how are you doing today? I'm sure you are doing healthy, fit and fine. Today's topic is on high blood pressure and how it almost killed me. When was the last time you checked your blood pressure? Do you know what had been your blood pressure yesterday? Well, I know for myself, I check it 3 times a day. But I do it for the last 1.5 years. But before that, I didn't know it either. Blood pressure, rather high blood pressure, had been diagnosed as the reason for my kidney failure. How dangerous can it be? I am a big example of this. So what is blood pressure? What is it actually? When your heart beats, it squeezes and pushes the blood through your arteries to the different organs. Now it is that pressure exerted onto these arteries that is called blood pressure. Now if this pressure is high and it is high on a continuous level, then it can become a chronic high blood pressure. Now, if you have seen those typical blood pressure monitoring machines, it gives you 2 numbers. You will see a number in the upper row and then there is a number below it. Do you know what is the reason for showing those 2 numbers? I mean, what do they indicate? What is the reason for giving 2 numbers in a machine? Well, let me explain. Even I was not very clear about those few years back. The number in the upper row is called the systolic pressure, which means the pressure when the heart beats and the blood is pushed through the different blood vessels, and that time the pressure is which is captured is known as the systolic pressure, and that's the number given showing in the upper row. Between the heartbeats, there is a very small resting period for the heart, during which time the blood is again, the heart is again filled up with blood and oxygen, gets ready for the second beat, and in the meanwhile, that resting period is what the diastolic pressure is, which is shown in the number below. Now, the standard is 120 by 80, which is again an ideal number. But again, any number above 140 or 90 can be termed as high blood pressure or hypertension. Now, what this number should be, whether it should be 130 or 140, is defined in various guidelines in various ways. But in general, through my experience in the hospitals, I had seen it's taken as 140 by 90. Anything above it is a hypertension. Now, the biopsy that I had to go through for the detection of the reason for the kidney problem, that indicated that the reason was high blood pressure, as in there was damage in the kidneys due to the pressure exerted on the blood vessels, which means I had high blood pressure and I didn't know it. I used to have frequent headaches on various days. That is something I knew. And thinking that headache itself is a disease, I was all into curing that. I was taking tea, I was applying balm, I was popping headache medicines, and so on and so forth. So whenever the headache came, I considered it as the primary disease, and somehow I had to get rid of it. So I did whatever needed and I got rid of headache. But the reality is, headache is not a disease. It's just a symptom that there is something wrong. Ideally, what you should do is identify what is wrong and try to get a remedy for that, and headache will automatically stop. Now, this enlightenment happened to me after a long time. So right now, I had been enlightened, and these days whenever there is a headache, I try to find out the root cause, what's causing it, but not really go into popping any medicines to release headache. High blood pressure is also known as a silent killer, because what happens as a symptom in a high blood pressure is generally mimicked or in disguise of the symptoms from other problems. Let's say you are having a little bit of headache, let's say you are having a little bit of shortening of breath. Well, shortening of breath is not common at all, but it can happen if the blood pressure remains high continuously for a long time. Headache is pretty prominent. Then there could be other things like some problems with the vision, some pain in the chest. There can be a lot of other reasons. I'm not going to go for a list of reasons because they will completely vary from a person to person. I mean, this thing has been kind of, I have realized over this last 1.5 years that no one can be given medical advice based on a generic kind of a body assumption, because everybody's biological numbers would be different. They react differently with different medicines. They behave differently at different situations, and whatever works for one person may not surely work for other person. Be it a diet suggestion, be it a health suggestion, everything, when it comes to health, it has to be based upon the personal statistics, not on a base of that, okay, it works for you, so it will work for everyone. It doesn't work like that. Surely doesn't. I know so many patients who are suffering from kidney problems, and trust me, one diet that works for me, I have seen that doesn't work for another person, and it had been so common. It's not a rarity. So, of course, I never give any medical advice, neither I have any certification in medicines. What all I can do is speak about my experience, and that is all what I do. If anybody needs medical advice, then of course the first person should be a certified doctor or any any person who is associated in the medical field. So somehow I had hypertension, and this is something that came up prominently in the biopsy report. Now, what had been the causes of those hypertension, I am yet to fully understand that. At times I go back in time in my mind and try to find out what could have been other indicators. But yes, there are few things I can surely say with a lot of confidence that helps in getting your blood pressure levels high. That would be a sedentary lifestyle, which most of us got after the lockdown started. Less of physical activities, less of exercises, more of eating, more of sitting in one place for a longer period of time. So all work and no play, that is something can be mentioned as a good reason for getting your blood pressure levels high. Another thing that I would suggest, I had suggested this to a lot of people, particularly for people who are above the 35 years or 30 years rather, they have crossed 30 years of age. You start monitoring your blood pressure at least once or twice in a week. I do it 3 times a day, every day for the last 1.5 years, because for me it is a routine now. After only checking the blood pressure levels, I take the medicines accordingly. But for you all who are healthy, fit and fine, what I suggest that you can buy a blood pressure monitoring machine. It doesn't cost much. We waste money in so many different ways, and I'm sure about it. And how much does a blood pressure monitor machine cost? Hardly 2,000 rupees, but it lasts very long. All it needs is 4 batteries, that's it. And you have the freedom to check it at your own will. So anytime you are feeling uneasy or you are feeling a throbbing headache, of course you do something to feel relaxed and get your headache cured, but at least check your blood pressure once. It will give you a great idea as in about your own health condition. Trust me, awareness is the key. Awareness is the first thing that comes to my mind when it comes to talking about prevention of any chronic problems. So once you have that machine, you can make it a habit that okay, after 2 days on this time I will check my blood pressure, or rather go for checking it whenever you are feeling uncomfortable. That way at least you know what your body is screaming about, and that would give you a lot of enlightenment. And when you talk to your doctor, if anything happens at all, you will be in a better position to explain yourself rather than staring blank at him. These had all been my experiences. I had been through all this. Monitoring blood pressure helps. Do you plan of starting to do it? Let me know. In the meanwhile, thanks for watching. Thanks for your time. I totally appreciate. We'll meet again.